Okay, so before we get into the specific medication classes and start diving in more and more to the drugs and how they work and everything, and really kind of covering what, the exciting part about pharmacy and pharmacology and what, Tarang and I really enjoy talking about, there are some ground rules that we need to cover. One of those things that we need to cover is the 6 rights of medication administration. By following these 6 rules, you're going to be able to keep your patient safe, which, as we know, is really kind of the number one thing the NCLEX is looking for, and that you're going to be able to, keep your job and just do a good job as a nurse. Or keep them safe, accurate, and everything. So let's talk about the 6 rights of medication administration. And hopefully this is not the first time you've heard of these 6 rights. Hopefully they've been covered in your pharmacology class, and you've noticed them kind of popping up on medication questions and things as you've been taking your classes. So again, this will just really kind of be a very brief lecture as we just kind of go through these points. So the first right is the right drug. What we want to know here is this the drug that the physician ordered, okay? Now, in most hospitals and in most places you'll work, a lot of all this is going to be done in an electronic medical record, okay? You'll scan the patient and then you'll scan the drug, and you want to make sure that drug matches what the physician has ordered. Because I can tell you that when you go in and you grab all your drugs from the Omnicell or your Pyxis or whatever medication storage system your hospital uses, it's very easy for those drugs to kind of intermix. It's definitely happened to me before that I'm in a rush. I go in, I grab all my drugs, I come back to my patient's bed, and lo and behold, a hydralazine has mixed its way into the Crestor bin. Okay, so that could be very detrimental to the patient. So just be very careful if you don't have like an electronic medical thing, or before you give, even with that, it's important as you're looking at your electronic medical record and the patient's medication administration record, that you're comparing what you see on your medication label to what the order is, okay? So is it the right drug? What's the expiration date? Especially with things like insulin, this is going to matter. You'll have expiration dates on all your insulins. That should be clearly marked. And one thing that I always do with every single nurse that I precept or nursing student is, before I even allow them into the medication room, I make them sit down and write out every drug. And even if they write out the drug, I'm going to ask them, what's that drug given for? What's that given for? What are we looking for? So if you're unfamiliar with it, you really need to consult the drug guide. And don't be afraid to call a pharmacist. If you don't have a resource available on your unit, call a pharmacy. And that's their job, is to know the drugs and understand them. So call the pharmacy, and I always have the pharmacy number really kind of as a speed dial on my phone. And just ask them really quickly, how should I give this? What's the best way to do it? I'm not sure about this drug, okay? So that is right drug. Now let's talk right dose. Are you giving the dose that the physician ordered? You need to perform any calculations that you might need. We've talked about drug calculations already. And with a lot of blood pressure medications, you might be halving a dose, or like with a carvedilol or something like that, you might be giving half a pill. So make sure that you're giving the appropriate dose with that, okay? Be sure that it's a medication that can be crushed or can be split, and then make sure that you're giving the appropriate dose with that, okay? Now, this also comes into play quite a bit with insulin. You'll find throughout your nursing career that some nurses like to kind of determine their own administration for insulin. If the patient's blood sugar is a little high, they might go ahead and toss a couple extra units on there. I don't want you to do that. Insulin is medication that you really shouldn't play around with, especially, I know I mentioned this in the podcast and in some of the videos and things before, but low blood sugars are one of the main reasons that we have rapid responses in our hospital. I'm on the rapid response team, and low blood sugars are one of the most common reasons. So a patient's blood sugars will come back at 200 or whatever, and that will call for maybe 4 units of insulin, and you'll see a nurse maybe give 6 or 8 or 10 units. Don't do that. just don't do that. I guess I'll leave it as simple as that. Give the right dose that is called for. Now let's go into right route. This is one that the NCLEX will question you on quite a bit. Now remember, when a medication order is written, you need to have the medication, you need to have the dose, and you need to have the route. So on your medication order, it should say IV, it should say PO, it should say PR. It should say the route that the medication is to be given. If you don't have a route for a medication, don't give it. There's one medication in particular that we give a lot in my hospital. It's called nimodipine. And from that, PI&E, we'll talk about this more in the future, but PI&E, we know that this is a calcium channel blocker. And there's a black box warning on this, because what it does is it comes in a big pill. It's like a horse pill, a big, huge vitamin-sized pill, capsule, I should say. And what'll happen is a lot of times it's given for stroke patients to help prevent vasospasming, with our hemorrhagic strokes. So what'll happen is it comes in this little capsule, and we can't give that capsule to a patient who isn't awake and can't take it. So what we have to do is we have to get the liquid that's inside there out. And so we'll draw the liquid out, in a little syringe or whatever. There's my syringe. It's not bad. So we'll draw the liquid out in our syringe, and what has happened is patients or nurses are then disconnecting their needle, and they're giving that in an IV. Now, nimodipine is to only be given PO. So there have been deaths, there have been very significant side effects and issues when nurses have given nimodipine IV, because they'll draw it up out of there, they'll draw it up out of a capsule, which is obviously a PO, and then they'll have it in their syringe, so they think, well, I guess I can give it IV. You do not ever change the route of a medication. If it's to be administered IV, PO, PR, IM, however, that's the way you give it, okay? Another one that I'll see, is insulin supposed to be given sub-Q. One way that I've seen nurses kind of make mistakes is they'll end up giving the sub-Q insulin, they'll end up giving IV. That has a much faster onset, and the body's much more susceptible to that, so that can also cause severe issues. Next one is right time. This one's important to talk about because medications are scheduled and need to be given at specific times. Like levothyroxine, that needs to be given in the morning before a meal. Your rapid-acting insulins need to be given right before a meal. And there's just specific times. Some medications need to be given right before bed. Your HMG-CoA reductase inhibitors, for example, need to be given before sleep. So because medications are on specific time schedules and they work on specific time schedules, it's incredibly important that you're giving it at the right time. This might just seem like a convenience issue, but it's not. The way that some medications work, they're very sensitive to the time that they're given. Another reason for this, like you might have a patient who needs albuterol and metoprolol. Okay, one's a beta blocker, one's a beta agonist. Giving these at the same time will kind of cancel each other out. Not exactly, but they'll have kind of a negative effect on each other. So it's very important to make sure that you give medications when they're scheduled, as they're scheduled, okay? The next one here is right patient. I don't have to talk too much about this. Obviously, is this the right medication for the right patient? And the one thing that you'll be tested on with the right patient is going to be 2 identifiers. Okay? Make sure you do 2 patient identifiers. Name and birth date, hospital record number, whatever it is. If your patient isn't able to speak, you need to be, verifying their name and birth date with what you see on their wristband versus what you see in the chart, because mistakes can happen, and you really just don't want a patient's safety, your career, and everything to come down to giving the wrong medication to the wrong patient. One way to avoid this is to pull medications for specific patients keep them separate and pull them at different times. So go give your medications to the patient at the right time. Make sure you're not mixing anything in there. Make sure they're not all jumbled up in a pocket. Don't pull every patient's meds onto one counter and just start ripping them open, because a lot of medications look the same, especially when we're talking IV medications. Most IV medications are clear, liquid, so it can be very easy to really mess things up and really cause severe harm to your patient. So whenever we talk harm to a patient, we're talking patient safety. Patient safety is what the NCLEX loves to test about, okay? So whenever you notice anything in your studies where we're with a patient safety issue, that's an area that you really need to focus on, especially with pharmacology with the NCLEX. Lastly, let's talk about documentation. You need to be documenting your medications after giving them. Don't document that you gave a medication prior to giving it. Don't scan it, save it before going in the room, before giving the medication or anything like that, because anything could happen. The patient may develop nausea. The patient, you might get called away. They might not get that medication. If you document that it was given and it wasn't actually given, then that's an issue. Okay. So again, for example, let's say you document ahead of time that you gave a blood pressure medication. You go into the patient's room, their blood pressure is 90/50, and according to the medical record, they were given a blood pressure medication by you. So just don't do that. Don't document ahead of time. Never chart ahead, okay? And if you don't ever give a medication, make sure you document why you didn't give it. So let's say never ahead of time, and document why not. This doesn't have to be a huge documentation or anything like that. If it's indicated for blood sugars were too low, you didn't give insulin for that. If blood pressure was too low, you didn't give insulin for that. They have explosive diarrhea, you didn't give Docusate for that. So those are kind of some of the reasons you might not give a medication. If you don't give a medication, leave a brief note, and if required, make sure you call your physician and let them know that a medication wasn't given and why. Okay, that's a change in the patient's plan, okay? So these are really the basic 6 rights of medication administration. Keep in mind that it's essential to know patient safety, to keep your patient safe, and these 6 things right here are going to be how you keep your patient safe. There's a downloadable PDF below this video. Make sure you download that. It'll print out as an 8.5 by 11. That'll go very nicely into like your pharmacology notebook or whatever binder. But that'll be a good way for you to remember this. Remember some of these stories, and make sure that you're always, before anything with an NCLEX medication question, think through the 6 rights, okay? If one of these 6 rights applies, the rest of the question doesn't really matter. We really just need to come back to these 6 rights, okay? All right, guys, if you